Hi guys, my name is Julia. Welcome to my channel. So today I will be doing a video on a day in the life of a home healthcare nurse. Yes, so I have been a nurse for over 8 years. I started working in the health field over 18, 19 years ago. I started out as a home health aide. I worked as a home health aide for a few years. I then became a CNA. I worked as a CNA for 8 years. But while working as a CNA at the hospital, I went back to school and I became a registered nurse. So, yes, I am now a registered nurse and I am working as a visiting nurse, the home health care visiting nurse for over 3 years. And today, I will be doing a video on a day in the life of a home care visiting nurse. So, as a home care nurse, it's important to call your patients ahead of time and schedule appointment with them, okay? Meaning that you call your patients the evening before or the night before. Let them know what time you are coming. This way, you don't just go to their homes and knock on their doors and they are not home, because this happens a lot of time. Because even though patients who are on home care are supposed to be homebound, it doesn't necessarily mean that they are going to be home all the time. You know what I'm saying? So it's important to call them and schedule with them. Sometimes they have doctor's appointments, sometimes they have prior engagements with family members. Sometimes they just don't want to be bothered, they just don't want to see you, they don't want you to come, and they will not open the door. Well, not some of them will, but a lot of patients won't open the door if you did not call them to schedule an appointment. So to avoid all this stress and the problems, I like to call my patients the evening before, let them know that I am coming. Okay, so the next thing that I do, in the morning, okay, the first thing I do when I wake up is grab my tablet. Okay, I grab my tablet like a crazy lady, because guess what? As a home healthcare nurse, you are always documenting. Documenting does not end. It's just how it works. You are always documenting. All right, so I complete my documentation from the day prior. I try to do that the first thing in the morning. All right, and then when I'm done with my documentation, I sync my tablet, because sometimes what happens is that the office, the agency that you work for, a lot of times the schedulers, they add new patients to your schedule, okay? And you won't know that unless you sync your tablet. And you don't want to be working throughout the day and you come to the end of the day and sync your tablet and then realize, oh, there was a patient on my tablet that I did not see, and the patient was probably there since the morning. That is just too stressful. So sync your tablet. I sync my tablet, ahead of time. I sync my tablet in the morning. This way I don't have this issue. All right, so after I do that, I go and make myself some breakfast. Okay, this way I am feeling good throughout the day. I'm not feeling tired or aggravated because I didn't have breakfast. All right, so I have breakfast. I also make some snacks to take with me to work. Okay, so that's what I do. All right, so when I'm finished with that, making my breakfast, making my snacks, then what I do next is at 8:20, I sign into my morning virtual conference meeting, or whatever they call it. If I see my first patient around 9 a.m., I have 6 patients, no start of care, just 6 revisits. I should be home by by 1:30, 2 o'clock. Okay, and when I say revisits, I mean patients who are already on service, they're not new. So basically they're usually for education in disease process. There could be wound care, they could be Foley catheters, it just could be a variety of different things, different diagnoses that we have to care for with those patients. Okay, so those are just, I call those regular patients. So my day is usually a little bit shorter and a little bit lighter, okay? Because it's not like I'm doing an admission. Everybody knows that an admission is just crazy, a lot of paperwork. All right, so 6 patients, I should be home by 1:30, 2 o'clock. Okay guys, so as a home care nurse, your car is your workstation. Your car is your office. So you know, your car may be a little bit messy. If you can keep it clean and organized, that's very good. But my car is usually a little bit messy. I try to keep it clean, but you know, I just try. Okay, so yeah, so your car is your office, your car is your workstation, and I will show you how I set up my car before I go to work. Okay guys, so this is how I set up my car before I leave for work. This way I have everything organized and I have everything close by that I may need, you know, throughout the day. So I already have my lunch bag in the back set up with my snacks and stuff. But right here, the things that I'm gonna need immediately, you know, I have here, this is my hand sanitizer, I have hand soap, I have water, I have hand wipes. I just keep these in this area. I use my water and I use hand soap, and I have my hand wipes here. I also have paper towels in my nursing bag over there. Okay, all right, so this is my little station that I set up every day before I go to work. All right, I make sure I have everything there. I also have hand sanitizer and hand soap in my nursing bag over there, which I use, you know, when I go to a patient's home, I use to wash my hands. Okay, all right, so over here on the passenger side, which I was just showing you where my nursing bag is, I have this plastic bag on the car seat as a barrier. So I have this blue barrier that I use, you know, when I go to a patient's home. I use this to put my bag on. I put my bag on the paper side up and the plastic side I put down. Okay, and that protects my bag. I also have Lysol spray just in case I see a COVID patient. Even though I have shoe covers, I still like to spray the bottom of my feet the bottom of my shoes. Sorry, not my feet, the bottom of my sneakers when I get out from seeing the patient. All right, here I have this is my surgical. This is my N95 mask. I cover it with my surgical mask. I have a box here where I store my mask. I have some Clorox wipes here. I usually put some Clorox wipes in a Ziploc bag, put it in my nursing bag when I go to a patient's home, and I'm finished checking their blood pressure and I'm finished taking their, you know, temperature, or you know, I wipe down my stethoscope. I wipe down all my devices when I get out of, you know, before I leave the patient's home, and put it back in my nursing bag over there. Okay, so this is, you know, basically I just like to have everything close by. Okay, so I just pulled up to the patient's house and I parked a little bit away from her house just so she doesn't get concerned. A lot of times when you learn as a home care nurse not to park in front of the patient's home unless you are ready, you know, to go inside, which I am not. So I just want to show you a little bit of, you know, how I get prepared to go to the patient. All right, so I get out my, undo my seatbelt. Oops, daisy. Okay. All right, so I did that. I sanitize all the time. I like to sanitize, wash my hands, make sure my hands are clean. As I did mention before that I have hand sanitizers in my nursing bag. While I'm with the patient, I'm sanitizing my hands right through. I like to, you know, wash my hands when I go inside of the patient's home, but sometimes the living conditions is bad and you just don't want to touch anything, so you always have your hand sanitizer. All right, so the next step, what I do is that I have everything over here in the passenger seat. Okay, so first I put my mask on, my N95, All right, and then I cover my N95 with the surgical mask. Oh, it's not on. Make sure it's on. Okay. All right. And I either wear my goggles, which I'm not gonna wear this goggles because I can barely see. I need to get a new one. And oh, here we go. And then I have this face shield, which I am going to put on to cover my face and to protect my face. Okay. And this is how I get ready to go see my patient. And depending on the situation with the patient, I may or may not wear a gown. And usually I put a gown on when I get to the patient's door. You know, when I get to the patient's door, right before I go inside the patient's home, that's when I put my gown on. Okay guys, so I am back from seeing my patient. Okay, so my patient is not as good as I thought she was. She has some redness and swelling to her left lower extremity. I did call her doctor while I was with the patient. You want to do that while you are with the patient as a home care nurse, because you know, you get out the house, you get back to your car, and there can be so many other distractions. Okay, so one less thing to do, even though I have to wait for that doctor to call me back. Okay, so that's one of the cons of being a home care nurse. There's not a doctor right there to just, you know, to just inform them what's going on. You have to call the patient's doctor, and most of the time you don't get to speak to a doctor. You speak to the receptionist or the personnel, whoever is in the office. You give them the information, you report to them what's going on with the patient, and then you have to wait until late at night when you're sitting down in your home relaxing for them to call you back. I mean, if it's an urgent situation, then they will call you back. But in a situation like this where the patient, well, that could be an urgent, but that is an urgent situation. So I am going to call back in a little bit, you know, just to make sure that my patient you know, get taken care of. Okay, so I am off to my next patient, and I'm going to close down my phone. I'm going to turn the video off because I can't record while I am driving for safety purposes. All right, so I'll talk to you in a little bit. I get home, I take my scrubs off, I shower, and then I do all my follow-up phone calls, whether it's to the doctor, to my supervisor, to my nurse manager, to the, you know, what else? What's what I call family members sometimes. Yeah, I need to call the family members. So I do all my follow-ups. And when I do all my follow-ups, I feel good, I'm at peace. Okay, so the next thing I do after I do my follow-ups is that I go and make myself something to eat. I either cook dinner or make a snack, you know, whatever is my plan for my meal plan for that day. That's what I do. And when I'm finished with dinner, I go sit down somewhere comfortable in my home and I complete my documentation. And while I'm not gonna say I complete everything, I do as much as possible, because after driving around all day and doing, you know, whatever you do for the patient, whether it's wound care or whether it's education, you know, you get tired mentally and physically. So I complete most of my documentation, and then I just relax. And what I do in the mornings, as I mentioned before, I try to wake up a little bit early, and I complete my documentation when my brain is fresh. Okay, and that's it. So that's the day in the life of a home care nurse. There's so many other things that I could talk about. I could talk about starter cares, but that's for another video. All right, so that's it for me for today. If you like my content, if you like this video, please give me a few thumbs up. Okay, subscribe to my channel so that you will see all videos that I post. You won't miss any of my videos. And what's next? So comment down below, you know, let me know if you have any topics, you know, anything that you'd like to hear about, anything that you'd like to learn about. I mean, I'm not a teacher or anything like that, but you know, you can comment, and I'll respond to your comments the best I can. Okay, so thanks for watching.